November is Pancreatic Cancer Awareness Month, and we want to do our part to spread awareness. So we are joined by Dr. Viral Ozo with Secours St. Francis Gastroenterology to help answer some common questions that you may have about the disease. Dr. Viral Ozo, thank you for joining us today.
Thank you so much for having me.
Okay, this is, a super important discussion, and I want to start with the basic. What exactly is pancreatic cancer, and how serious is it?
So pancreatic cancer is a cancer of the organ called pancreas.
Okay.
Pancreas sits in the middle of the body, between the front and the back. I always tell my patients that it sits kind of in an angle form. People ask me how big is it? It measures about 10 to 12 inches, so roughly the size of a foot-long Subway sandwich, more or less.
Okay,
so it's an easy
right there. Yeah.
It's a pretty large organ, and most people don't realize how large it is and the amazing job it has, which is to help in glucose regulation. It has a job in helping make digestive enzymes. It really helps us absorb everything we eat. So when you get a cancer of an organ that important, it tends to send subtle signs much before it actually declares itself, meaning much before we can actually see it. But also oftentimes it results in some symptoms that are oftentimes ignored by patients, which are quiet signs.
Okay, let's talk about some of those quiet signs.
Yeah.
What could they be?
So one of the common signs that patients sometimes notice if they have, before pancreatic cancer is diagnosed, is weight loss. People start losing weight, and I always tell this to patients, if you're losing weight and all you're eating every day is hamburgers and pizzas,
Something may be right.
And not doing any exercises, then something's amiss, and you should probably get yourself checked out by a primary care doctor or your gastroenterologist or some physician specifically. Sometimes pancreatic cancer can also cause back pain. Why back pain? Because pancreas kind of goes, like I said, at an angle towards the back. So sometimes it can involve some nerves on the backside of our body, which can result in some back pain. Oftentimes, patients who have pancreatic cancer can start turning yellow, and they have no abdominal pain. That's called painless jaundice. So generally in our world, when someone starts turning yellow and you have no abdominal pain, that could mean bad news. And that's something that you should really, look into that.
Okay, if anyone, notices any of those signs or symptoms, obviously they need to go see you. Are there any regular tests you can do to see could anything be wrong?
Yeah, so we can do a lot of CT scans, or there's lots of diagnostic radiological studies that can be done to look at the pancreas. There's also endoscopic ways to go in and diagnose pancreatic cancer. If, for example, somebody has, say, a mass in the pancreas, then they would come to someone like myself who would then do an endoscopy. We'd go in from the mouth through the food pipe into the stomach, look at that pancreas in great detail. We can stick a needle into the pancreas, do some biopsies. So there's a lot of different ways to actually diagnose pancreatic cancers. But more than that, there's also treatment options that are up and coming which can help us treat pancreatic cancer, also endoscopic.
Okay, what are some of those options?
So one big endoscopic option for treating pancreatic cancer is sometimes doing a nerve block to help with that pain, for example.
That back pain that you have?
Pain,
okay.
Right, exactly. So that's one option. Another up and coming option is something called a radiofrequency ablation of the pancreas mass. So we stick a needle into the mass and actually use microwaves to kill some of that cancer. So there's that option as well. Other times we can actually help our radiology colleagues by putting little markers in the tumor so they can target the radiation beam in a specific area.
When they aim for it.
Right, so there's lots of treatment options out there, and our science and technology is evolving so rapidly that we're seeing more and more least invasive tests coming up.
Is there anything that we're doing that causes it?
So that's a very good question. So one common theme that we've seen across all cancers is that we're diagnosing more and more patients with obesity. So there is a link of obesity, being overweight, having a lifestyle that is not rich in fruits and vegetables, and having a sedentary lifestyle that has been shown to be associated with higher rates of pancreatic cancer. Things like smoking also don't help pancreatic cancer risk either. And then, of course, alcohol abuse. And drinking a lot of alcohol can lead to developing chronic pancreatitis and recurrent pancreatitis, or swelling of the pancreas attacks. That can increase your risk of pancreatic cancer also.
All right, y'all. So at the end of the day, it's about lifestyle. You know what I mean? We're not saying don't ever have a cheeseburger and never have a drink, but let's try to be mindful of what we're putting in our bodies. And then at the end of the day, we are lucky to have Secours. If you need to, make an appointment, get a referral, learn any more about it, what's the best way to get in touch with y'all? Yeah,
so our website is great. You can go into our website, the Secours website, and try to reach us that way. We have people who can respond to online messaging as well.
Okay, so nice to meet you. Thank you so much. We appreciate it, Doctor. Very good.